Our next speaker is Mello from Stanford University School of Law. Thanks, Michelle.
Thanks, Bernie, and thanks so much for that really helpful overview of the digital landscape. I was asked to expand on some of the themes regarding the ethical landscape that Deborah just awakened. To me, some of the most interesting problems arising from the development and integration of these digital technologies into both research and clinical care arise from the fact that we are expanding individuals' data tracings and using their existing tracings in some novel ways. And that puts pressure on a lot of the norms in human subjects research ethics, as well as on our existing regime of privacy laws. So I want to talk about 4 old problems in research ethics that I think have gotten a lot worse because of the advent of new digital technologies, and 3 new ones. And this is certainly not an exhaustive list of the issues that arise. Our speakers on AI, I'm sure, will want to add others, so I won't go there. I'm not going to talk about hacking or security issues. But I think there are some really interesting problems to think about. First, to the old problems. The first is the one that I'll call the problem of purpose and repurpose. And the question here is, can data that are generated for one purpose be used for another? Or does doing so violate the principle of informed consent? The old versions of this problem will be familiar to you. For example, can biospecimens that were taken for clinical purposes be used in research without the person's fresh consent? Can research data collected to explore one question be used by researchers to explore some other unrelated question in the future without fresh consent? But there are new versions of this problem now. For example, can user data generated through interactions with apps and websites be used for research purposes? And if so, whose research? Can clinical data generated by digital technologies in the care setting, such as ambient listening devices or surgical black boxes, be used in research? Or can they be given or sold for research purposes? What about purposeless analyses? Data mining takes the problem to a new level here because it's often non-hypothesis led. David Hand has referred to this as being possibility-driven rather than purpose-driven research. And it really upends this question of purpose and repurpose if you don't have a purpose in the first place, but are simply exploring in a landscape of data. And can data for which the generators never contemplated linkages to other data sets be linked to these data for research or clinical purposes? The possibilities for linkages now are infinitely greater than they ever have been in the past. For example, in a recent lawsuit against Google and the University of Chicago, a patient whose electronic health records data were sold complained that even though the data were putatively de-identified because of Google's analytical capabilities, they could potentially link his smartphone geolocation data to the EHR data to find out which clinics he had visited on which days for what purpose. And once he'd been re-identified, could link those data to a variety of other social media and online browsing activity. Historically, there have been 3 main solutions to this problem: de-identification, waiver of consent, and blanket consent. As I'll discuss, de-identification is just infinitely harder when we're talking about digital data than it is for tissue specimens. Consent waivers are a very pragmatic solution. The IRB can simply get rid of the problem, but in my experience, those decisions have tended to be driven by a simple determination that it would be a really big hassle to get fresh consent. In other words, impracticable. That's not a very principled solution to the problem. Blanket consent has the benefit of transparency, but we can argue it's pretty meaningless if we can't explain to people what all the potential range of uses of their data are, as well as these potential future data linkages. So I think there's an urgent need for deliberation about the problem of informed consent here that arises from repurposed digital information. But I think there are also real serious limits to transparency as a strategy here. It's not helpful if we can't describe to people what they're consenting to. And it's not helpful if the users of many of these technologies have no real choice about accepting the terms of use. The second problem I want to mention is what I'll call the problem of context transgressions. As Deborah mentioned, privacy theorists like Helen Nissenbaum and Daniel Solov and the philosopher Tamar Sharon have argued that people's expectations about privacy vary according to the context, including the type of relationship in which the information was given and the uses to which it's expected to be put. You might feel one way about your doctor sharing very, very sensitive clinical information with other people in your care team, and quite another about Facebook sharing much less sensitive information about you with others for commercial purposes. The problem is that with very swiftly flowing digital information, the potential for transgressions of context is very, very high. This is related to the problem of purpose and repurpose, but it's distinct. What I'm talking about here is the shift from non-commercial to commercial uses of data in particular. That's an enormous shift in context. And it's problematic because empirical research shows us that people's willingness to give information varies dramatically depending on whether they think it's going to be used for non-commercial or commercial purposes. There are old versions of this problem, of course, the Henrietta Lacks case, the Moore versus Regents of University of California case, holding that people have no intellectual property rights in their cells. The new version, though, is much more complicated, with healthcare organizations selling massive amounts of electronic health record data to tech companies to develop products and services. Historically, the answer has been simply to clarify to people that they have no rights to the share of the profits from technologies developed from their biospecimens, and or to strip away identifying information. An alternative strategy would simply be to wall off commercial and non-commercial contexts and say that there will be no sharing of information, but that doesn't strike me as either feasible or desirable. We want the products and services that will come from this kind of data sharing. Another strategy is maybe to shift people's privacy expectations by essentially blowing up the idea of context, eliminating any presumption that there are walls around where our data may flow in the future, and saying you are essentially surrendering control of your information in exchange for a variety of benefits that you're already receiving through free services or very low-cost services online, and that you'll receive in the future through the development of precision technologies and so forth. But that is a pretty fundamental shift from a model of individual control over data to a model of group deliberation and benefit sharing. And it's very much at odds with where our current net of human subjects regulations and privacy laws is today. The third problem is a problem of corporate involvement. Of course, for-profit corporations have long been involved in biomedical research. For example, pharmaceutical companies have long sponsored the majority of clinical trials of new drugs, and there's long been concerns about their influence. But today in the digital technology space, companies are more dominant than pharmaceutical companies have ever been in the context of drug development. And the influence of traditional bulwarks of research ethics, like academic researchers with our norms and IRBs that we're subject to, is relatively weak, and it's not clear that there are any trustworthy mechanisms in place in the industrial sector to replace them. Most tech companies no longer need us. That is the sad reality. They don't need our analytical capacity because they've gotten so good at it themselves. They don't need publications to show that their products are worthy of approval and use. As Chris Castle has observed, the only thing they really need from universities these days is access to patients. And yet that's increasingly less the case as well, as they go direct to consumer to get health information, as Deborah talked about. So who will guard the corporate involvement in this area of research? While the involvement of corporations is essential, it's exciting. It raises a host of issues that we're only beginning to grapple with. Fourth, briefly, the problem of what I'll call incidental research subjects. It's out of vogue to talk about people as research subjects rather than participants, but I'm using that term very deliberately because what I'm talking about here are people who come under the observation of researchers, not by dint of their consent to be a research volunteer, but because of their association with others who have, or who have undertaken to use digital technologies that also sweep in their information. Ambient listening devices that sweep in more than one voice, for example. Social media posts that discuss other identifiable individuals. This is also an old problem. Genetic data, for example, reveal information about family members. But the new version of the problem is much, much broader because our digital tracing sweep in family members' geolocation data, again, social media posts, listening devices, all of these things implicate all of those around us as well. And so even in a world in which we were to perfect informed consent for individuals, we still have the question of these incidental research subjects. But despite this reality, again, the dominant paradigm continues to be one focused on individual control of data, and the paradigm being, I sign this end-user license agreement or this consent form, and that takes care of the problem. So all of these are old problems that have been made more difficult with the advent of digital technologies, let me touch briefly on 3 problems that I think are new and distinctive to this era in the 21st century. One is the scale of data collection. Because of ambient and mobile devices and other passive data collection technologies, data can now be collected with little cost and effort, opening up huge possibilities for expanding the scope of data collection. More speakers are going to talk about passive data collection later in the day. But I'll simply say that despite the benefits of this, it really raises a few concerns. Obviously, privacy. For example, should surgical patients be able to opt out of having their surgeries recorded or black box data collected during their surgeries? We don't let them opt out of other quality improvement efforts. Data quality. App users have the ability to fudge data in a way that was not traditionally been possible in clinical trials. And social consequences. Can doctors stigmatize or discriminate against non-compliant patients when their non-compliance is detected through passive data collection, for example? I'll leave it to later speakers to say more about it, but I do think it's a new challenge. Second, the end of anonymity. Simply put, de-identification of data is now recognized to be a mythical or at least a temporary state. I don't need to belabor that point for the people in this room, but we know because of the advances in hashing techniques and computer science, twinned with the increasing availability of lots of kinds of data out there that can be triangulated, it's now more possible than most people realize to re-identify individuals and link data from anonymized data sets. And that, again, calls into question the entire architecture of our human subjects research ethics regime, which is predicated on the notion that once de-identified, data involve no risk to the user, and the user, therefore, has no right of control or right to have that research project receive oversight. So really, it calls, I think, for a fundamental rethinking of our way of governing transfers of data and calling into question of the assumption that de-identified data transfers need not be supervised. Finally, there's the problem of the ethical adolescence of data science. As I've discussed, research in using digital technologies is being conducted by a very different constellation of organizations than traditional biomedical research. Our training and acculturation in science and medicine impart a certain set of norms and ethical commitments that I think are not true of the training of computer scientists today. That's not to say that data scientists or technologists are unethical or disinterested in ethics, just that they're not fully mature yet in our thinking. Like teenagers, they're learning as they grow. They may not seek or listen to advice until they make big mistakes. And they may lack a fully formed value framework to guide their behavior. But teenagers are guided in their moral development by a watchful overseer and a gradually retracted set of boundaries. In contrast, technology companies today enjoy a very high degree of autonomy and freedom to self-regulate, with neither strong external controls nor strong internal ethical controls. Privacy laws have a few things to say about what they can do, but not as many as people think. To borrow a turn of phrase from David Hannon and Jacob Metcalf, I think there's a need to establish this profession as a distinct moral community. Initial codes of ethics developed in computer science are a good start, but there's a need for more. So in conclusion, I think there's a tendency to talk about this area of ethics as a brave new world, but some of these are ancient problems. We have new permutations that I think reveal that the cracks in our foundations of human research ethics are broader than we once realized. And I have 2 strong instincts about how to solve these problems. One is that they can't be adequately addressed within our existing regulatory regime. And the second is that they shouldn't be addressed only by people of my generation and older, that the conversation has to be, it has to include people in younger generations who have very distinct ideas about privacy and about the trades that we're making for that privacy. Thanks very much.